Here we will be dealing with one of the very important topic of the cardiovascular pathology, that is acute myocardial infarction. So what is the definition of acute myocardial infarction here? Definition of acute myocardial infarction. Acute myocardial infarction refers to an acute onset of severe chest pain. Every word you have to concentrate here. Acute onset of severe chest pain. Acute onset of severe chest pain, more often associated with occlusion of one or more coronary arteries. So why there is acute onset of severe chest pain is because of block of one or more coronary arteries. Because of the blockade of one or more coronary arteries, there will be an acute onset of severe chest pain, and it is associated with, very important question, and it is associated with coagulative necrosis of the myocardial tissue. So, coagulative necrosis. Coagulative necrosis of the myocardial tissue, it is called as acute myocardial infarction. So after discussing about the definition, what about epidemiology? What about epidemiology? Remember that most common cause of death in the adults in the United States as well as worldwide is the acute myocardial infarction. So it is the most common cause of death in United States as well as worldwide. Most common cause of death in United States, and it is predominantly seen in men between 40 to 65 years of age. Men predominance, that is 40 to 65 years of age. 40 to 65 years of age, and remember that at least 25% of acute myocardial infarctions are clinically unrecognized. This is one of the very dangerous conditions because 25% of acute myocardial infarctions are considered to be silent without any clinical manifestations, so unrecognized. So this is what is about the epidemiology of the acute myocardial infarction.